Good afternoon, everyone. Thank you for joining our MEDITECH Expanse Roundtable discussion today, hosted by ROI Healthcare Solutions. We are recording this call today, and if you have any questions, feel free to type them in the chat box. We will have a dedicated time for questions at the end. I'd like to especially welcome our panelists today and allow them to introduce themselves. Start with James Reed, please.
Yes, thank you. Hey, my name is James Reed. I'm the Chief Information Officer for Conway Regional Health System in Conway, Arkansas. We are a multi-facility health system that operates in the north central part of the state. Our flagship hospital, Conway Regional Medical Center, is a 150-bed acute care facility. We also own a 25-bed inpatient rehab facility and then manage a 25-bed critical access hospital. In addition, we have approximately 15 clinics that are spread across our service area that have a wide array of specialties, all the way from family practice to orthopedics and general surgery. We've been a MEDITECH site since 1997, starting out on Magic, and then we moved to MEDITECH 6 in 2012, and then followed that with 6.1 and added ambulatory in 2017, and then recently just made the move to Expanse last year. We are also moving to Expanse 2.2 with web patient care later this year as well. So thank you for allowing me to be a part of this.
Wonderful. Skip.
Good morning, everyone, or good afternoon, everyone. My name is Skip Rollins. I'm the Chief Information Officer at Freeman Health System in Joplin, Missouri. We are in the southwest corner of Missouri. We are a 3 acute care hospital system. We total about 500 beds. Like James, we're a community health system. We have a wide range of specialties, and we service an area of about 500,000 people. As today, we are a MEDITECH 608 customer in the hospital and a GE Centricity / Athena Health customer in our clinics. We have about 70 clinics in a 4-state area and approximately 300 providers that are working in those 70 clinics.
Wonderful. Thank you, Skip. And now I'd like to introduce Jeff Tennant, our presenter today.
Yes, good afternoon, everyone. As Danielle said, my name is Jeff Tennant. I'm the Vice President of HIS Strategy and Services here at ROI Healthcare Solutions. I've been in the industry for as long as I care to mention. Had many titles over the years. One 15 plus years ago, hospital CIO in Fort Smith, Arkansas. Have worked with numerous organizations on operational improvement projects, from revenue cycle to clinical strategies and other improvements, working with organizations on their workflow and industry best practices. So very excited to have James and Skip on this call today, and look very forward to our roundtable discussion and hope you find it beneficial. So the purpose of today's discussion is going to be to have James and Skip share some of the decision-making processes that they've either gone through or are going through, and the criteria that they've relied on, what their role has been in the decision-making process, how they've engaged physicians, other hospital operations executives, other hospital operations areas, and then talk a little bit about where they have, where they plan to, or where they maybe wish they had engaged an outside organization like ROI to assist in the process, maybe share some of the lessons that they've learned through this process, as well as anything else they're willing to share with our audience today to help as they're going through similar decision-making processes. One thing I'd like to discuss is, MEDITECH, a lot of people maybe don't know, MEDITECH still has the largest standalone community medical center number of hospitals are as clients, and they continue to expand their market share. And I think the Expanse product has really helped put them at the forefront of the decision-making process for a lot of organizations, and has gotten a second look from organizations that in the past may have thought, well, MEDITECH's not for us. MEDITECH's done a lot of really good things. And I say all that knowing that, MEDITECH didn't pay me to say it. We're not associated with MEDITECH on this guy. I just wanted to share with our audience some of the things that are going on with MEDITECH Expanse. So as we look at the benefits and the key features of MEDITECH Expanse, they're listed here. I'm not going to read through them all, but we are going to talk about these with James and Skip. So James, if I could, first question to you, what were the key functionality improvements that played into your organization in making the decision to move to the MEDITECH Expanse platform?
Thanks, Jeff. So I think for us, the goal was, and it was really to move towards one chart. And that's what we actually call MEDITECH here. We call it one chart. So when you look at all our points of care, I mentioned we have a rehab hospital, we have a critical access hospital, we have a flagship acute care hospital, and then all of our clinic locations. It was moving towards that one chart vision, not only from a clinical standpoint, but also from a revenue cycle standpoint. So, for example, we can use the same documentation templates in our emergency room. For example, like for patient family social history, those are the same templates that we use in our clinic. So once that information is completed once, it can be viewed very easily and updated very easily at future points of care. So that was a big driving force for us looking at going to Expanse, and one of the reasons why we chose to move to Expanse. Navigation and flexibility. When you look at it being a web-based solution, there's a lot of pros to that. Deployment, mobility. There's things that makes it easier since it is a web-based solution. So that flexibility and also being able to navigate. When you look at Expanse, again, we've been a MEDITECH client since '97, and they don't pay me either, Jeff. So I don't always sing their praises, but the Expanse platform, when you look at it and try to navigate through it, even for somebody like me who may not be a clinician, it's very easy to navigate into the chart. So especially compared to previous versions. So that was a big one. And then I think the final thing I'll say is for our practitioners and providers who are in the clinic setting, but also practice in the hospital. For example, our general surgeons, they can very easily toggle back and forth between their hospital practice and their ambulatory practice in the Expanse platform. It's just a single click that saves them time versus having to log out, log into another system, or even within MEDITECH previously, log out and log into another job that they would have to do. So those are big time savers for our providers.
Thank you, James. And Skip, I know your organization hasn't made their final decision yet on what direction you're going to go, but as you look at the enhanced functionality, what are the most attractive areas for your organization and what you're looking at for this potential transition?
So Jeff, I would say that you have to understand a little bit about our environment. I'll take this one second and do a quick review. Being a community health system, being in business for over 90 years, we have a lot of different environments, and over the years, Freeman has acquired many EMRs into our environment. And I think that as we in IT try to integrate the information, share the information, get it out to the people who need to have the information, we have come to really value interoperability and James's point, a single chart. And I would say that's the biggest attraction to any of the EMRs that are in the marketplace for us, is reducing the number of integrations that we have to build, reducing the number of places that clinicians have to go to see information is really our number one priority. MEDITECH and Expanse in particular, what really attracted us initially was the mobility capabilities. We have physicians, and I'm sure James does as well, that get in their cars and drive to clinics, and they're all over the place in that 4-state area where we are. And part of the struggle that we have is them having a consistent experience when they come into the system from different ways. So that mobility piece is something that we were always very attracted to, but also more than anything, the single chart, the ability to reduce that number of EMRs in our environment, reduce those integration challenges, and get them a consistent experience in the system was for sure our guiding principle. We love the web-based platform. We think it's will make it easier for us. We have tons of people out there in our environment today that like to use tablets, whether that be an Android tablet or an iPad, and we know that, and we've seen from MEDITECH that you can use those tools and be very effective, actually do actionable things via the tablet, where you can't do that in other environments. So for us, that modernizing the tool, if you will, making it mainstream by offering all those features and functionalities is super attractive to us. And so we love. We have a separate oncology EMR. We have a separate home care EMR. We have a separate behavioral health EMR. So the ability to leverage those capabilities in MEDITECH as well to reduce that number of EMRs is certainly attractive. So I would say interoperability, mobility, and then technology are the three things that really are attracting us to the expansion platform.
Thank you, Skip. So James, as we look at your organization, what are some of the things that went into your organization's decision-making process when moving to Expanse platform and also looking at the implementation itself?
So for us, whenever we try to make big decisions at the medical center, we always think about our strategic initiatives first and then work our way back to kind of operationalize that. So from a electronic health record standpoint and some of the things that Skip mentioned are our biggest strategic initiatives, where we also had several different EHRs in our health system at the same time, especially in our ambulatory setting, which was creating challenges from a revenue cycle standpoint, and then just a support standpoint from the IT staff, from being able to support a multitude of different electronic health records. So, the one strategic initiative we had was to consolidate that as well. And so then also, getting feedback from our end users. So not only, of course, IT staff and nursing staff and pharmacy staff, but also certainly our providers. What do you want to see in an electronic health record? What's not present now that you would like to see? What are some things that would make your day easier? And of course, they gave us a laundry list of things. And not to say that Expanse checks all those boxes, but it certainly checked enough of them, and plus just our comfort level as well. With the MEDITECH platform aided in that decision. So again, we kind of worked our way back. Where do we want to be in 5 years or 10 years? I mean, obviously it's a big decision on an upgrade on an electronic health record, and then what do we want to get out of it? And so that helped us kind of frame those questions, both on the implementation standpoint too. So what do we want to get out of this upgrade? Because it is a significant amount of time you're going to be working on that. So what do we want to build into what's in scope for the project? So those conversations at the beginning really helped frame our decision.
Very good. Thank you, James. So Skip, as your organization is in this decision-making process, what are your primary evaluation criteria for choosing either MEDITECH Expanse or looking to move a different direction?
Well, Jeff, I'll go back to what I said before. We're looking for, a new way of doing things, and I would say that one of the things that our stipulation to MEDITECH from the get-go was to have to do what they call a ready implementation, because we really felt like that we couldn't get to a new environment from where we were. There's so much luggage that we had drug around for years. When Freeman went from Magic to the 6.0 platform, they didn't really step back and look at the organization, redo workflows, processes, really take a look at yourself. So therefore, a lot of the things that was wrong in the Magic platform got drugged into the 6.0 platform. So early on, we made a commitment that no matter what vendor we chose and what vendor we went with, that we were going to start anew and really base it off that vendor's best practice models to make sure that we stayed aligned with the workflows that would allow us to get the maximum utilization out of that platform. So, that guiding principle, and, we've talked before, Jeff, many times, and you've heard me say this many times, that the EMRs are like cars, right? They all kind of do the same thing. The buttons are in different places and they have different options, but in the end, they all do the same thing. So really, we approach this as somewhat business decision in that we wanted to make sure that we understood how it would impact our business and our ability to grow our business, but also how it would, what were the limitations of it, and what were the things that, as we look at our strategic initiatives, could we do with those tools as they're delivered? Because we didn't want to go in there and start saying, we need to add this to it because we need to be able to do this. We wanted to really look at that base functionality, that best practice model, and stick with that best practice model. So the evaluation criteria really for us was, does it fit our vision? Does it fit what we're looking for in an EMR? We certainly have committees and we certainly have oversight groups that look at those things, but transparently, it was about our business and this tool being supportive of our business and our initiatives. We didn't want to customize, we wanted to stick to their tool. So we certainly saw MEDITECH as the incumbent. We certainly gave them every opportunity to keep the business, but we also did it with our eyes on what else is in the marketplace and what features and functions the other players had in the marketplace. And what we saw in the end was, I mean, you can point in any direction and see something one vendor might do a little better than the other, but the collective whole is what we're looking at. And we felt like, and still feel like, even though we haven't fully committed to do Expanse, we feel like that MEDITECH offers that to us. And we love the direction that MEDITECH as a company is going. We love the new management structure and how aggressive they're being with technology and really, you know, to James's point, offering new and improved modules out there to you that really enhance workflows. And that used to be very un-MEDITECH-like, and now they're getting aggressive about the technology. And at Freeman, we love that because we're big believers in that.
Very good. No, I appreciate that answer, Skip. So this question is going to go to both of you. You know, how important is formal governance in establishing your evaluation criteria, and what have you found helpful in establishing the evaluation criteria and engaging your clinicians in that process?
So for us, Jeff, I mean, probably like most institutions, but the biggest thing I would say is we have a physician advisory committee, number one. So that's me and then several physicians and other IT support and even some other administration that participates on that comprise of different specialties that we meet monthly. And during our journey, we did not make a decision without consulting that group of physicians. I mean, I'm talking about down to what kind of devices they wanted to use, where they wanted to put them, everywhere, because it's their day, it's their workflow. I mean, they're in and out of it significantly more than I am. So we do compensate our physicians on our advisory committee. I think that was a decision we made several years ago. That was a positive decision. They are taking time out of their day to stop seeing patients to kind of help us make these decisions. So we felt that was the best use of our resources. So we built that in, of course, to our project plan. We also have another steering committee that's comprised of representatives from clinical, non-clinical areas. So they kind of work in tandem with our physician advisory committee, and we seek to get as much feedback as possible. You know, the IT department, we provide the solutions, we provide the recommendations, but we want the end users to have the feedback onto how their day is shaped. So, and of course, the engagement with the physicians, that's going to be, you know, probably the most vocal group you may hear about after an EHR upgrade. That's probably no surprise to any of us, but just having that buy-in with them made those decisions a lot easier. And it saved me some difficult conversations because I can say, you know what, how about you talk to the chairman of our PAC committee about that, because that was the decision we made, and that's a physician, that's not me. So, you know, they set the agenda, we kind of just fill in the gaps. So that was crucial. And if you don't have a physician advisory committee, that's like the biggest thing I could probably suggest right now as far as structure to make sure you put in place during this journey. It was invaluable to us.
So Jeff, from my perspective, you know, I totally agree with James said. I mean, we don't, in IT, we don't get paid to make decisions. We get paid to provide tools to folks. And I think a lot of folks overstep. We in IT are all pleasers, you know, and so a lot of times we see a gap and we step in there and we try to help things, but ultimately in the end we hurt things when we do that. So we strongly believe in curating an environment that allows our users to give us guidance on any decision, just like James said. So sometimes it's difficult to pull it out of them. Sometimes it's difficult to get them in the room. But from my perspective, that cultivating that environment that they own the system, that they're empowered to make those decisions, is one of our fundamental principles. But you know, and I'll go back, our structure, and I think that one of the things that we talked about that we did before we really even got close to choosing a vendor in this was to sit down and really talk about what it was we were looking to accomplish by moving to an EMR. And we went department by department, service line by service line, and really spent some time talking with them about what they didn't like about the tools that we have today, and what they did like about the tools that we have today. And we tried to narrow that down to a list of primary initiatives that we were looking to accomplish by spending a 9-figure amount of money to make sure that we knew why we were spending that money and what we were trying to get out of that money. And I think that, you know, once you get on the same page with folks about what the EMR is going to do for you and what it means to that individual department or service line, then you get a little bit of ownership from them that sometimes you can't get. And you get them willing to participate in the committees that James spoke about. And I'm a big believer in governance committees and governance structures because, again, I am, and my folks will tell you, I don't get paid to make decisions about what happens in the cloud. I'm not going to do that. But we certainly can create an environment where the lab knows what decisions they have to make, and we can certainly tell them that what's the boundaries of the tool that they have and how far they can go with their decisions. That's what we in IT do. But from my perspective, I really want an environment where we've curated a sense of ownership of the users and a sense of participation. And to James's point, and I'll say this, and I said this when we did the rehearsal. Those of you in the audience, if you haven't read the article that MEDITECH published about the ARCH Collaborative and the success, how really successful organizations have successful implementations, take 15 minutes and read that article. It's easy to find it on the internet. It has some wonderful guiding principles about how to have a successful implementation of any EMR. It's agnostic on the EMR. The statistical information in there is really interesting. But overall, the guiding principle in that thing says that the more participation you have from your physicians, the more successful your implementation will be. And so we believe that as well. And like James, we have a PAC committee that's divided into 3 groups: the people that love technology, the people that hate technology, and then the people that sit in the middle between those two. So we go after that middle group, right? So, but you want those antagonists, you want those people that hate the EMR to give you the reasons why they hate it, and you need to be able to listen and see what you can do to solve that. So while, you know, for us, getting that participation is very difficult, but using that participation to make smart decisions is a really safe place to go as a CIO when you have the support of those clinicians, the physicians, the nursing community, the ancillary departments that's supporting the decisions that were made. Then you get better buy-in and ultimately better results.
Thank you, Skip. Those are great answers. So James, as your organization, you know, went through the transition, you're up on the Expanse platform. What areas of your organization were most deeply impacted during the transition, and what areas have had the biggest changes to their daily workflow, their daily jobs on the new platform?
Yeah, certainly, you know, and of course we're kind of like Skip. I mean, MEDITECH we're a community-based hospital, so MEDITECH is our backbone for every department in the hospital, from revenue cycle to clinicians. So everybody ultimately was impacted. But to your point, there was obviously some areas that were probably most or higher impact than others. Certainly, I kind of mentioned it earlier, our providers, you know, moving from a 6 platform, even 6.1 on the acute side, it's different on the web acute. It's totally different for providers. So all that muscle memory that they had developed over years of us being on that 6 platform, they had to change and had to learn new muscle memory when we went to Expanse. It's better. It's a better product. It's a good thing that it's different, but still they're used to clicking and not even really thinking about it. So they had to start thinking about things again. You know, with our nursing staff, even though there wasn't a lot of changes between 6.1 and Expanse, We did deploy the WPL, the web presentation layer. So that was a kind of a new wrinkle for them working off the website. We did that consciously, number one, to help from a support standpoint, but then number two, to kind of lay the groundwork for our move to web patient care later this year. And then the back office. So definitely revenue cycle. We probably all think about that, but a conversion would certainly involve a bar conversion in MEDITECH terms, revenue cycle conversion. So that resulted in increased AR days. Our CFO is not happy because our AR days are going up, but that's just something you have to expect with a significant EHR conversion. So we did things like look at taking out, applying for a line of credit just in case we needed to. Fortunately, our health system has been in a very good position and has several days of cash on hand, but that was something we just, as a conservative approach, looked at taking out a line of credit just in case we needed to keep businesses operating while our conversion was happening. So, another area that was significantly impacted was HIM, our medical records department. So when you look at chart abstractions and release of information and just how they function, it was a big change for them as too. So those back office areas were significantly impacted. We all think about, and I do because I'm a clinician by background, think about the pharmacists and the doctors and everybody else and the nurses, but we certainly can't forget about the people who are making the hospital money from the revenue cycle, collections and all that stuff. So those were the biggest areas I think for us that we try to put a heightened focus on through some extra support in those areas and really try to show them some love and care during our conversion. So.
Okay. Thank you, James. That's good. As you look at the decision-making process, Skip, and what's going on, what groups in your organization have been most engaged in the process of, evaluating this, MEDITECH system as well as the other systems? And then what have been some of their main concerns or areas that they've wanted to compare between the two or three vendors that you're looking at?
So, Jeff, again, I want to state that we've not made a formal decision, but we certainly are strongly considering MEDITECH. I would say that, if you ask that question to any CIO anywhere, any EMR, they're going to tell you it's the physicians, because the physicians are the ones that are saddled with putting all the information in the system that kind of makes the EMR world spin. So they certainly at Freeman have been vocal. We're lucky at Freeman that we have a really good CMIO who has worked diligently to bridge that gap between the tech folks and the physicians to make sure the physicians understand the limitations of the tools we have today and why the limitations. But they certainly, the concerns they express in talking to my CIO peers out there, it doesn't matter if it's Epic or Cerner or MEDITECH, the concerns are always the same. It takes too long. It gets in the way of them taking care of the patients. It makes their clinic day long. We're an academic medical center, so we have students in there all the time, and we certainly hear it from them as well. So they're not predispositioned, if you will, about hating EMRs because they're still kind of green, but they wonder aloud why we have to do it this way sometimes. So getting that feedback from the folks and hearing what they're saying generically is it's not very user friendly. The EMRs are not built to be very user friendly. They're data gathering tools, and we need to feed that monster with information, and that's time consuming. So if you talk to any other organization, the folks that are documenting in the system in the clinical environment, you'll get that it takes a long time. I don't have time to do that. I still hear physicians that says, why can't I dictate everything? Well, that's not how we do it anymore. Why can't I just write it on the chart and somebody enter it? Well, that's not how we do it anymore. Why can't I just tell the nurse to enter the order? That's not how we do it anymore. So we still have that culture out there. And it doesn't matter that it's Freeman Health System in Joplin, Missouri. You can go to an urban medical center and you'll hear the same thing. So it's systemic when we look at that problem. But so as we look at what we're trying to do in the evaluation process is understand how that tool presents that workflow to the clinicians and understand how he or she can they adapt to that tool? Can we stop doing it the way we've always done it and move forward and make progress with maximizing the use of that EMR? So that's really where we are, and we've been evangelizing that really hard for a long time. And, you know, Jeff, you and I have talked about this more than one time, and James, you and I have been in similar conversations before, and it's a problem that doesn't go away, even if you install Expanse, because you still have to educate, you still have to evolve as an organization to use the tool. And if you're not willing to do that, you know, no matter what brand it is, it's not going to work. So I'm a firm believer in talking about what you have to do beforehand to cultivate the environment, and knowing that the science is out there to prove that you will be successful if you do certain things. So we're at that point. We're at the point where we're educating, we're talking, we're looking at different tools, we're giving those clinicians forums to ask questions of other vendors, and we're getting feedback. And one of the things that's really that you hear a lot of positive feedback in MEDITECH Expanse is really their new web presence platform. It's really user friendly. It's easy to understand it. It's not nearly as cluttered, and that's something that we hear. I won't say universally, but very, very often about the tool. So, and I feel like part of the reason why at Freeman is because we have worked so hard to cultivate use the technology environment, be mainstream about what you do, and stop doing it the way you've always done it, do it the way everybody else is doing it. And I think that's part of the reason too. So from my perspective, these evaluations that we've done, these demonstrations that we've done with folks is really about us educating our users about the tools, being transparent about what our goals are with the project, and then working with them to have a reasonable amount of expectation of what their role is when we do an EMR install. And I think that transparency is one of our guiding principles, and it is proven to be successful.
Thank you, Skip. So James, this question is going to go to you first, and then to you, Skip, for your comment on how you're planning. But what consideration was given or is being given to transition resource planning, to free up your current team members, both in the IT department and other areas, so they can focus on the implementation, the training, and education related to the new platform?
So that's a question, Jeff, that everybody needs to really put a lot of time and thought into it, because that needs to be built into your project. I will say we've kind of gone on both ends of the spectrum in my time here at Conway Regional. When we transitioned from Magic to 6, we were heavily engaged with a consulting company that we had a lot of had a project manager, and then we had a lot of specialists from the company that were helping us with the build. And then on my part, I thought when we went to 6.1, we may not need to engage that much because it is an expensive resource. And so we were a little bit on the scaled back version, and that really, I put a lot of stress on my IT team during that conversion. So we made it, and we did it successful because they're a group of people that I'm sure, like is most everybody's department. And I think Skip mentioned it, they're people pleasers, and they want to do the best job they can, and they do a good job. But we have to give them the resources. So that has to be included in your thoughts when you're scoping your project. I will say MEDITECH gives very good recommendations on how many bodies, how many FTEs that you need to have for each module on the build. And then you got to also think, and you mentioned it, Jeff, you're keeping the lights on too. You're supporting the current system that's in environment. You're trying to build out the new system and test it. And then you're supporting everything else on your day-to-day operations of just keeping the lights on. So I would definitely recommend that any organization on the EHR transition, consider heavily outside resources. And not a lot of us don't go through a lot of EHR transitions. In my time here, maybe we're just an anomaly. I've gone through 3 so far, and every time I say that's the last one, but there's probably not going to be a last one. But work with a company who's done that before. That's what they're here for. And again, listen to MEDITECH. Skip mentioned this, but I think MEDITECH has made great strides, not only in their implementation process, but in their criteria and their material that they provide to you. They have a very good process, a very good structured project plan. They will tell you if you're not hitting your milestones. They will chastise you if appropriate if you're not hitting your milestones. So and I applaud them for holding us accountable, because we all want a successful go live. But I can tell you, having outside resources that specialize in implementation of a health system or electronic health record system is a necessity for us, and we'll always do that going forward. So I won't be cheap the next time around like I have been. So.
And Skip, your thoughts on that?
Well, from my perspective, I couldn't agree more with what James just said. Jeff, I was a consultant for many years, and James, I've been through more than 20 EMRs and installs, and when you look back on them, you can remember the really bad ones, but you don't necessarily remember the really good ones that well, because the bad ones kind of stick to you. But I would tell you that all CIOs are prideful, and all CIOs think that their teams are great, and we all believe in what our teams can do, and we all depend on our teams very, very heavily every day. But to James's point, I think it's pretty naive to think that you can do it internally. I think that you get perspective from an outside resource. You get not only you get their experiences that they have at other organizations, and the MEDITECH CIO community is relatively small, so a lot of us know each other. A lot of us talk to each other about these things, and we're lucky enough to be able to shoot an email to a peer and say, how did you guys handle this? Who did you use? Were they good? Did they do a good job for you? What kind of problems did you see? And I think it's naive of us to not take advantage of what our peers have done. So these implementation partners that the ones that have a lot of implementations under their belt are super valuable in our eyes. We've never considered not using one. But I think the perspective that we get from that and the experiences that they have just gives you even more things to consider, knowing what's successful, knowing what's not. But I, James and I know each other, and I know James knows folks that are CIOs, and I do as well. And understanding what other people have done and why they've done it is gold in a CIO chair. And so from my perspective, I consider it to be mandatory. And if you don't do it, then I think you're making a mistake. And I will say, I know I said this in our discussion about before. We worked really hard to monetize what that cost, to understand what that cost, and we've worked really hard to be able to apply numbers to it. We believe that there's a shocking number of hours that go into an implementation, and we've looked at how many of those hours can we in IT provide, how many of those hours can our users in the environment provide, and how many of those hours do we need a third party to help us with. And and that's the big variable almost universally when we talk to my peers, is how much help do you need and how much is that going to cost? Well, it's usually a lot and a lot, because there's only so much you can get out of your users, right? And especially during 2020, we just kind of shoved our EMR aspirations to the back burner because our users have been crushed for a year dealing with COVID. So we would be into an implementation right now had it not been COVID. But so understanding that for us, that 40,000 hours that we need from those users that we can't account for, we have to go to a third party to do it. And it will be a trusted advisor, and it will be someone that has Expanse experience and somebody that we trust. And we are certainly not naive enough to think we can do that ourselves, because we can't. So that's my answer to that question.
Thank you, Skip. I appreciate that. So as we kind of wrap up this roundtable discussion, James, I don't know if there's any parting lessons learned you'd like to share with the audience, and then Skip, any parting words of wisdom? I think we've shared a lot already, but if there's anything that you just say, hey, I wish I would have said this, feel free.
I think the only thing I would add, Jeff, is to try to make it as a big deal of an experience as you can, for lack of a better term. I mean, moving to a new electronic health record is a big deal, but typically, the IT world, those things may just not get celebrated as much as they should. So we try to make a big deal out of it, not only with our employees, but with our department. We work with our marketing department to kind of come up with some, logos, and they helped us with our one chart design, and we did t-shirts, and we did all this creative stuff that I don't think about because I'm a meat and potatoes guy. So they definitely, kind of try to have as much fun with it as you can. I mean, it's a year-long process in most cases, so it's gonna stress you and it's gonna stress your staff, but there are opportunities to kind of celebrate and give them some recognition. So I think that's a big part that we try to do with this last initiative for us.
And Jeff, for me, and I said this before, and we've approached this as a 15-year decision. We've approached this much in the same way you would a building construction program or those kind of things, because we don't spend this kind of money every year at Freeman. We don't take on initiatives that affects every single employee in the health system very often. So we have been deliberate for sure in our decision-making process. We've done financial analysis. We've done every way we can to look at this initiative to make sure that, I'll go back to what I said in the very first question, we're reaching our goals. We're doing what we meant to do in this process. So from my perspective, make sure you approach it with a financial thought in the back of your mind, because ultimately you, the CIO, are accountable for that. But also approach it like a business decision and make sure you know what you're trying to accomplish, and make sure that you're keeping those goals in sight when you're planning a project, and you're putting in the ability to measure your successes in those goals. So when you as a CIO get asked, why did we do this? And you can go back and say, here's what we were trying to accomplish, and here's what we have accomplished. And I from my consulting days and my days as a CIO, I would tell you that many times we get asked, why do we do this project? It costs too much, or we're not doing this. We always go back to our scope and say, this is why we did it, and here's the accomplishments that we had, and here's the numbers to support. So from my perspective, as a CIO, that would be my words of wisdom.
No, I appreciate that, and thank you, Skip. And James, thank you both for participating today. And as we look at, as both of you talked about the cost of a good implementation, the cost of good implementation is nothing compared to the cost of a bad implementation. I think we can all three agree on that. We've all been through that. We've seen, that. So I'd like to ask, the listeners, those that are on the thing, if you have any questions that are, maybe some have already typed questions into the chat box, and Danielle, if you could just share with us some of those questions you're seeing, that would be great.
Absolutely. So let me just give everybody a minute. The panel on the right side of your screen should give you an opportunity to send in a chat. You can send it just to the organizers or to the group. Okay, we've got a question here for Jeff. It says that my organization's evaluating our potential transition to Expanse, and I'm curious what ROI could do to help us, what assistance ROI could provide.
Well, I appreciate that question. I mean, we weren't looking at this as being a salesy presentation, really more informational for our audience, but my response to that, we do a lot of different evaluation type functions for clients. We can help you with TCO analysis. We can help you with clinical operations, revenue cycle operations analysis, so that once you do transition to your new platform, you're not doing it, as I think Skip said, or no, maybe it was James. You take the problems of your old implementation, your old system, into your new system. It's a great time to look at how you improve operations and make sure that you are able to feed the beast, for lack of a better term. And so all of those types of analysis we can provide. We also do have an arm of our business that provides transitional staffing. We currently work with numerous organizations that are going from one platform to another or from one system to another by providing kind of that short-term backfill staffing to free up your folks to do what they need to do as they look at the new systems and learning to use and work with the new systems. So there are several things that we do in that space, and would be happy to engage with anyone. Reach out to us. We'd be happy to talk with you about what we can provide and how we could provide those services.
Great. Thank you, Jeff. Okay, we've got another question. How did your team support the current version while also focusing on the new implementation?
Yeah, so that's a great question. I'll take that one real quick, and certainly Skip can chime in. He's been through a few of these as well. And I think to Jeff's point and what we were talking about earlier, the most successful is allowing your staff to be able to not only keep the lights on, because we all have to do that, but then also have enough time to get used to the new system, build it out, test it out. And so, and that's where additional resources come in. I mean, to Skip's point, we don't have enough staff. To be honest with you, right now we're about 20 FTE IT department, about half of those being on the analyst side, on the MEDITECH side. So you look at a pool of hours of about 10 people between keeping up with all the tickets coming in and then trying to build a new system, learn a new system, train end users on a new system. And then when you think about elbow-to-elbow support after go live, especially across the whole health system, when you have maybe 60 or 70 providers, and then it's just a manpower issue, and you just can't really do that successfully without bringing in those resources. So yes, you're going to have an investment there on the licensing and the hardware and all that stuff with the system. But what you also have to keep in mind is you need some dollars set aside there, and it's going to be a substantial amount. Not to sugarcoat it, for the consulting bucket, if you want to call it that. Which to Jeff's point, there's we've used people where we've had project managers, we've had actually individuals helping us with the build in the system, and we've even done some where we've had some that provide some elbow-to-elbow support. But what I've always wanted to do is make sure that our staff is looked at as the subject matter experts for the system. So yes, we're going to supplement them with consultants and build time and stuff like that. But we're the ones that are going to be in the barrel, so to speak, after the consulting engagement ends. So we need to make sure we fully understand what's being done and what's happening. So I'm not sure if that addressed the question exactly, but you have to be able to expand your pool of resources, and the best way to do that is engaging with a partner that understands what you're going through and has been through it before and understands, if it's MEDITECH, what's going on with MEDITECH. So
Wonderful. Thank you, James. All right, we're right at 10 minutes until 2 Eastern. So I think we're going to wrap it up. Thank you again to Jeff for the wonderful moderation, and to Skip and James for your participation and your insights. To everybody, we will be sending out the recording. Also, take a look at our social media page, ROI Healthcare Solutions. We'll also post a link to to access the recording there as well. You all have a wonderful afternoon.
Thank you. Thank you, Skip. Thank you, James.
thank you.